Every bite you take sends a message to your body, either one of nourishment or one of stress. Diabetes is a condition that disrupts how your body uses food for energy, often going unnoticed at first. Are you fueling your cells to thrive, or making your body work overtime to keep up? By understanding how food, sugar, and insulin interact, you can make choices that support your health. Let's uncover how small changes can help your body regain balance and energy. Diabetes is when your body struggles to manage blood sugar or glucose, the main fuel for your cells. After you eat, glucose travels through your bloodstream to your cells. In a healthy body, this process is tightly controlled, keeping energy steady. Diabetes happens when this system breaks down. Either your body can't make enough insulin or can't use it well. Insulin acts as the key that lets glucose into your cells. Without it, glucose builds up in your blood, causing high blood sugar. This leaves your cells starved for energy, even when there's plenty of sugar in your blood. Remember, diabetes is a metabolic issue, not a personal failing. Deep within your body, an unsung hero quietly works to keep you healthy: the pancreas. This vital organ produces a hormone called insulin. Insulin is the key that unlocks your cells, allowing glucose or sugar from the food you eat to enter and provide energy. Without insulin, glucose would be trapped outside the cells, unable to fuel your body. When you eat a meal, especially one rich in carbohydrates, your pancreas immediately springs into action, releasing insulin into the bloodstream. This is a carefully orchestrated response to the rise in blood sugar levels. The released insulin acts as a signal, instructing cells throughout your body to open their doors and allow the glucose to move from your blood into your cells, where it can be used for energy. Think of insulin as the key, a master key that fits every lock on your cells, and your cells as locked doors, each one needing that key to unlock and receive the energy they need to function properly. If insulin works effectively, your blood sugar levels are carefully regulated, returning to normal after meals as the glucose is efficiently absorbed by your cells. But if the pancreas is damaged or overworked, it may not be able to make enough insulin, or, even if enough insulin is produced, your cells may become resistant and stop responding to its signal. In either case, glucose stays in your blood, unable to enter the cells and provide the energy they need. This is the fundamental problem at the root of diabetes, a condition where the body struggles to regulate blood sugar levels effectively. It's like having either not enough keys to unlock all the doors, or locks that simply won't open, no matter how many keys you have. Understanding insulin's crucial role in this process makes diabetes less mysterious, empowering you to take control and manage the condition more effectively. It's a problem with a clear cause, a disruption in the insulin pathway, and fortunately a problem with well-defined solutions and management strategies. Diabetes is a complex condition, and it's important to understand that there isn't just one type. There are two main types of diabetes: type 1. This form of diabetes typically emerges earlier in life, and type 2. This is often associated with lifestyle factors and develops later in life, though increasingly we're seeing it in younger individuals as well. Type 1 is characterized by the body's complete inability to produce insulin. Insulin, as you may know, is the key hormone that allows glucose or sugar to enter your cells and provide them with energy. In type 1 diabetes, this vital function is entirely absent, like losing all your keys. You simply can't unlock the door to let the glucose in. It's usually caused by the immune system, a defense system that normally protects us from infections and diseases. But in type 1 diabetes, the immune system mistakenly identifies and starts attacking insulin-producing cells, specifically the beta cells in the pancreas. This autoimmune reaction often starts in childhood or adolescence, although it can occur at any age. Because their bodies can't produce insulin, people with type 1 need daily insulin injections or infusions to survive and manage their blood sugar levels. Type 2 is a different story. In type 2 diabetes, your body still makes insulin, sometimes even more than usual, especially in the early stages. The problem is that your cells become resistant to the effects of insulin. They don't respond properly to the hormone, making it difficult for glucose to enter and fuel them. The locks are rusty, and the key, insulin, struggles to open them. To compensate for this resistance, the pancreas tries to keep up by making more and more insulin, attempting to force the glucose into the cells. But eventually, after years of overwork, the pancreas can't keep up with the demand and begins to fail, leading to elevated blood sugar levels. Type 2 is strongly linked to lifestyle factors such as obesity, physical inactivity, and unhealthy eating habits. It typically develops in adults, often after the age of 40. However, due to rising rates of childhood obesity, type 2 is now increasingly seen in younger people, including teenagers and even children. So, to summarize, type 1 is fundamentally a problem of production. The body simply doesn't produce insulin. Type 2, on the other hand, is primarily a problem of effectiveness. The body produces insulin, but the cells don't respond to it properly. Because the underlying causes are different, managing each type requires a different approach. Insulin therapy is essential for type 1, while type 2 management often involves lifestyle changes such as diet and exercise, and sometimes oral medications or even insulin to improve insulin sensitivity or boost insulin production. Ultimately, knowing your type of diabetes is the first and most crucial step toward effective management and preventing long-term complications. High blood sugar is like syrup in your bloodstream, causing damage over time. Sugar sticks to blood vessels, nerves, and organs, leading to inflammation and slow, silent damage. Tiny blood vessels in your eyes, kidneys, and nerves are especially vulnerable. This can cause vision loss, kidney problems, and nerve pain or numbness. High blood sugar also hardens arteries, raising the risk of heart attacks and strokes. Wounds heal slowly, and infections are more likely. The damage often starts silently, so regular checkups are crucial. Managing blood sugar protects every part of your body. Your body sends warning signs when blood sugar is high if you know how to listen. Extreme thirst and frequent urination are early clues as your body tries to flush out excess sugar. Unexplained fatigue happens because your cells can't access the energy they need. Blurred vision, slow healing sores, and frequent infections are other red flags. Unintentional weight loss, especially in type 1, is a serious sign. Sometimes symptoms are mild or absent, especially in early type 2. That's why diabetes is called a silent condition. Damage can happen before you notice. Regular health checks and paying attention to your body's signals are key. Receiving a diabetes diagnosis can feel overwhelming, like a major turning point in your life. It's natural to feel a mix of emotions, but remember, this diagnosis isn't an end, it's an opportunity. It's a chance to build a healthier, more vibrant life, taking control of your health and well-being. This is your moment to redefine your lifestyle and embrace positive changes. Focus on 4 key pillars, the cornerstones of managing diabetes and improving your overall health. These pillars will serve as your guide as you navigate this journey. First, consider how you eat. Nutrition plays a vital role in managing blood sugar levels. Second, move your body. Physical activity is essential for insulin sensitivity and overall fitness. Third, prioritize sleep. Adequate rest is crucial for hormone regulation and energy levels. And fourth, manage stress effectively. Chronic stress can negatively impact blood sugar control. When it comes to food, choose real whole foods, the kind that nourish your body from the inside out. Load up on vegetables, aiming for a rainbow of colors to maximize nutrient intake. Incorporate lean proteins, which help keep you feeling full and satisfied. And don't shy away from healthy fats. They're essential for hormone production and brain function. At the same time, cut back on processed foods, which are often high in unhealthy fats, sugar, and sodium, and eliminate sugary drinks, opting for water, unsweetened tea, or other healthy alternatives. Move your body daily, find activities you enjoy and make them a regular part of your routine. Even a brisk walk helps your muscles use sugar better, improving insulin sensitivity and blood sugar control. Prioritize sleep, aim for 7 to 9 hours of quality sleep each night to support hormone balance and overall health. And create a relaxing bedtime routine to wind down before sleep, signaling to your body that it's time to rest. Manage stress with deep breathing exercises, which can help calm your nervous system. Practice mindfulness, paying attention to the present moment without judgment. Or spend time in nature, which has been shown to reduce stress and improve mood. Remember, small, consistent changes add up over time, leading to significant improvements in your health. These changes will lead to big results for your blood sugar levels and overall well-being, empowering you to live a healthier, happier life. Experiment to find what works best for you, tailoring your approach to your individual needs and preferences. Every step counts, no matter how small, in the right direction. So, start with one today. Choose one small change you can make and commit to it. Share your ideas and questions in the comments below. Let's support each other on this journey to better health.